Good afternoon, everyone. Thank you all for joining today's discussion on hygiene's role in stopping the spread of harmful viruses. First, a little about who we are. Cascades Pro is a product line from Cascades committed to creating safe and feel-good public spaces with proven hygiene solutions. As a leader in North America, we've developed 5 sub-brands of specialized towels and tissue products to ensure all industries, their employees, and their guests are supported and protected. As for me, my name is Frederic Perreault. I'm the manager of Cascades Research and Development Center. Our team is dedicated to develop new and innovative solutions for our 3 Cascades divisions, which are packaging solutions, hygiene and tissue solutions, and also fiber-based materials. Joining me today is an expert in the field of hygiene and someone we've had the chance to collaborate with in the past, Dr. Charles Gerba. Dr. Gerba is a professor of microbiology and immunology at the University of Arizona, and he has authored over 500, in fact, I had that stats at 500, but he's now at 700 journal articles. So he's very well known in the field. And he is best known for his work on environmental germ theory in the household, and that has earned him the nickname Dr.Germ. His work has had a lot of impact globally. For example, his work on the spread of norovirus led to great changes in cleaning, sanitizing, and disinfecting practices. And also his study on the pathogens that were found on shopping carts has prompted supermarket chains nationwide to adopt the use of wipes for customers. Really, his goal is to reduce the burden of diseases and share insights about techniques and good practices that can help stop outbreaks or at least minimize their impacts, like hand washing and hand drying. So Dr. Gerba, thank you very much for being with us here today. We know as a top microbiologist like you, you're probably a very busy man during these pandemic days. So we appreciate the fact that you take some time with us today. Maybe as a first question, starting from your Ph.D. at the University of Miami, you've had a great deal of experience working with viruses and pandemics over the years. Can you tell us a little bit more about the research you've conducted and what you've learned from them? I guess workspaces or work environment is a place where germs can spread a lot.
It is. I mean, really, and I'm doing a lot of studies and studying how viruses spread in hotel rooms when maids clean. We've seen the same thing, how they move the viruses to one area to another or during a conference and that. And I really think the hand is quicker than the sneeze and the spread of disease, really, from what we've seen, because we're a touch generation. We're generation touch. We touch more objects every day than any generation in history, and we spend more time indoors. 80% of our time is believed now indoors. Where 100 years ago, we've learned most of us were farmers and only went into town maybe once a week. Where now we're going into larger office buildings, bigger stadiums, bigger hotels, bigger airports. And all of these create a situation when you're bringing more people into more places and you're touching more common surfaces and sharing more germs than any generation in history. You know, from what we've seen developed over the years is this recent pandemic is really we have the situation now where we have the perfect storm for the reasons I just mentioned in that. Infectious disease can spread so rapidly today, and you can see it in this pandemic around the world. And so it's quite interesting. It's sort of the thing a lot of people were expecting to happen, just the right organism at the right time. But anyway, that's a lot of what we've done is looking at how these organisms spread and then looking at interventions, what works. Hand washing, hand sanitizers. How much reduction in transmission do you get by using these novel new disinfectants? How can we interact? So that's kind of our area right now. We're doing a lot on looking at innovative ways of trying to reduce the spread of like SARS-CoV-2 and what kind of interventions would work to reduce the risk and spread particularly in public facilities, is what we're really after, in education of the public and giving them scientific information to show that interventions really work in reducing their exposure.
So, and as you're telling us, you've worked with many different microorganisms or germs. Uh, is there something different with COVID-19 than you've seen from other viruses?
Yeah, I think what it is, it's more easily spread than that. I remember I was involved in the original SARS outbreak investigations, and I always had wondered, boy, what it saved the world in is the virus doesn't survive well in the environment or not easily transmitted. You had to get within 3 feet or 1 meter of somebody to really get it. I always wondered, well, if we had the right virus that survived longer than that, it would have been a pandemic. But fortunately, it wasn't in that. And so we're dealing with a situation where we have the ideal virus at the ideal time in the 21st century for its spread, I think. But we've always seen the evolution of new viruses too. And really, just to go back a little bit in my career too, I've seen one emerging pathogen after another, cryptosporidium and waterborne disease, the AIDS virus. We were involved to make sure it didn't transmit it through the environment. And then we had bird flu, swine flu, the original SARS, and then the Ebola virus. So really, we see these viruses being spread much more readily because of the situation in the world. And viruses, microbes evolve too. They're not static. We're dealing with a virus that didn't even exist a year ago. And suddenly it evolved and spread. So that's what's really the dynamic of what we're faced with. The microorganisms are not giving up. We're their food supply, and they're always hungry.
So as you're saying that the virus will be around, and they've been around for a long time, and the COVID-19 is surviving well in the environment. Again, that brings more and more importance into trying to break this cycle of exposure to that virus that's in the environment. So I guess that's why hand hygiene is such a critical step in the circulation of the virus that we can break or stop.
Yeah, you know, to reiterate maybe a little bit, is most people don't realize how important hygiene is. You know, when hygiene, the idea of the germ theory became into existence, we saw really a 98% decrease in a lot of diseases like typhoid and tuberculosis and that. Actually, good hygiene had more impact on the reduction of human diseases than all the antibiotics and vaccines combined. Most people don't realize what a huge impact hygiene had on human health. Really, there used to be, back in the 1920s and 30s, hygiene parades and fairs to get people to adapt to hygiene. And that, in some ways, we lost that in the 1940s and 50s with the development of antibiotics. Everybody thought that was the solution. Well, it wasn't, because the microorganisms eventually evolved to be resistant in that. So I think we underestimate the impact of everyday hygiene in reducing our risk of infectious diseases.
And as it relates to the importance of hand hygiene, Cascades conducted a study in July, and that was regarding the effectiveness of hand drying methods. And what we found out is that Americans are not placing the same importance on hand drying as they do hand washing. In fact, 84% of Americans think it's extremely important to wash hands after visiting public restrooms, whereas only 48% of Americans think it's extremely important to dry hands after visiting a public restroom. So these stats show that there's a clear disconnect between the importance that is given to hand drying versus hand washing. So can you explain why hand drying is so important in the overall hand hygiene process?
Yeah, you know, most people don't recognize you still have some organisms left on your hands, for one thing. And so I think that has actually been overlooked a lot of times. Also, if your hands are still wet and you still have some germs on them, they'll be more easily transferred to a surface if your hands are wet versus your hands are dry. It's something people look out. You know, in our studies, we were kind of, and it becomes important too, I think, in our observational studies in public restrooms, only half the people use soap to wash their hands. They just rinse them off and then shake the water off like they're blessing somebody. And they don't realize that there's still microbes that haven't done a good job. And so hand drying becomes even more important because that emphasizes the importance of that barrier. The other thing is half the people don't wash their hands long enough. In our studies, only 11 seconds was used versus 20 seconds was recommendation. So hand drying becomes even more important for those individuals. When you look at the whole picture, people don't adequately wash their hands and dry them. From what we've seen, 1/5 only come out of this. 1 in 5 has adequately done a job of washing their hands. And so then drying becomes even more important because that adds a little extra barrier too. We've also observed in our studies that people prefer paper towels versus air blow dryers. I mean, there's issues with potentially spreading the microbes from air blow dryers and around in that, but we've observed fewer people will wash or dry their hands if there's a blow dryer versus paper towels. So that's one of the reasons we've always been really recognized the importance of hand drying. You know what, I think what it is we've always said hand washing. We don't say hand washing and drying is what we've really missed in educating the public, I think.
And would you see any other benefits of using paper towels versus air dryers as a drying method?
Yeah, I think one of the things a lot of people don't do, I mean, because we've done observation studies, don't do it long enough, and they tend to blow the organisms around in the facility. That's been documented in several studies. You tend to circulate them around, so there might be greater exposure. So there's really two things. One is movement of the organisms that may be on your hands around in the facility. I think people don't do it long enough. Then people to finish off drying their hands on their hips, which actually your hips for that reason are the germiest part of your clothing, by the way. I certainly don't slap people on the hips anymore for that reason because I know that's the germiest spot. Besides that, I know slow is not good adequate. But anyway, I think what it was is people use alternatives or they don't dry their hands or wash their hands. And that's my big concern. And you end up potentially contaminating the restroom more.
Mm-hmm. And from studies that we've read, we also know that paper is quite efficient in terms of drying speed. It takes just a little bit of time, like 10 seconds, to dry hands using paper towels. And we think it's one of the reasons people tend to prefer paper towels because of the speed at which they eliminate residual moisture on hands. And also one other aspect we found is that there's friction generated between the paper towels and hands that contributes even further to the removal of microorganisms. Mm-hmm. Is that something you would agree with?
Yeah, I really like it, and it's also because it's discarded too. You know, we've done studies in homes, and one of the germiest objects in a home is the hand towel or face towel, because the organisms get transferred into your hands there, and then people rub them into the towels. And so we've actually found out one of the greatest places to exchange germs is the towel in the home, believe it or not. I actually think, particularly if somebody in your home is ill, you should be using paper towels. Otherwise, you're going to share it with a cloth towel really readily. Actually, we've collected hundreds of towels in homes, and we found that if you dry your face with a towel in the home, you would get more fecal bacteria in your face than if you put your head in the toilet and flushed it. That's how bad they get in the home because it's wet, it's moist, they grow. But certainly my feeling is from what we've done in studies in homes is that if somebody's ill in your home, I really feel you should use a paper towel because you shouldn't be sharing towels or taking a chance with it or individual towels at least.
Mm-hmm. Because of the cross-contamination that occurs from there.
Right.
Yeah.
You avoid that with towels. And also cross-contamination is less likely from paper. To give you an idea, if you touch a surface like steel or formica, you'll get half the viruses and bacteria on there. If you touch it a paper material, you get less than 1%. So transferability is very low.
Mm-hmm. Yeah, that's an important aspect. And as public spaces continue to open, or maybe we're seeing a reverse trend right now with the increase of the cases we see. But many Americans are returning to work in their physical workplaces. And the study we conducted in July has shown that 50% of the Americans are actually quite worried about hygiene in the workplace. And that is especially because of COVID-19. Um, what do you think the public needs to know about the spread of germs in the workplaces?
Well, I think most people don't realize that 80% of all germs are spread by your hands. That's what the Centers for Disease Control of the United States says. So a lot of the solution is really in your hands. And I don't think many people realize that, like, you take the common cold, it's almost entirely transmitted by you getting the virus on your hands and then touching your nose, mouth, or rubbing your eyes. You can actually transmit the common cold and influenza by rubbing the virus in your eyes, by the way. That's another mechanism of it. And people are going to do that all the time. Small children under 2 touch their face about 81 times per hour, older children down to 50, adults 15 to 24 times per hour. So really, you're putting your fingers in your face about every 3 or 4 minutes without realizing it. And every time you do that, you create a situation where you can transmit an infectious disease. I mean, really, the human hand is the best friend a germ ever had from what we've seen in our work. And it's really not only how you contaminate yourself, infect yourself, I should say, but you're moving the germs around on surfaces all the time with your hands all the time. You can't believe how germy, for example, a cell phone is. There is more bacteria on a cell phone, sometimes more than 100, than a toilet seat, for example. So it really, people don't realize we've made germs more mobile. We've done studies where we've seen where people pick up germs and put them on their cell phone, and then they put it in their pocket, bring it home, use their cell phone, and transmit those same germs to other objects in their home. So we were making germs more mobile than ever before. So I don't think people realize how many things they're touching in a day, hundreds of things, moving germs around on mobile devices. And the other thing is to realize where you're touching an activity. In an office building, you find more fecal bacteria in the coffee break room than you do in the restroom, to be really honest. And the reason is disinfectants are used effectively and more often in the restroom. Where in the coffee room, people are making foods. And really, we've learned the coffee break room is the place where people exchange both germs and gossip at the same time. And it ends up being most of the germiest place in the office building. And so I think there's more care. I really believe you should always have a hand washing station with paper towels in the coffee break room, because hand washing has become important. In fact, one of the germiest objects is the tables in a coffee break room. Why? Because that's where your hands are all the time. In our studies, where we've seen the germiest areas where we'll find viruses, bacteria of concern, is where you're putting your hands all the time. That's your desktop, your tabletop, your airplane trays. Anything where you have your hands activity all day is going to be really germy. In a classroom, for example, with children, the germiest object is their desk. There are more fecal bacteria on a 4th grader's desk than a toilet seat in the same facility. So it's really quite interesting. People have neglected how fast and where bacteria are going to accumulate. It's where your hands are going to be most of the day in any kind of public facility that you might go to, even like restaurants. It's amazing in restaurants. That's one of the other areas I like to talk about. Is we gone in and ask a server to wipe our table before we eat. And usually they put a thin layer of E. coli down for you to eat with you there on a table. And why? Because the cleaning dishcloths or sponges don't get enough disinfectant acting like they're supposed to, or they don't use a dwell time like they're supposed to. So I mean, I would think they should really use a dry paper towel to really do it, or some other drying device on the tabletop. So that it's really more important. You'd be amazed how germy the areas where you're going to eat and be, and where you get. cleaning tools and drying tools that you really need in the facility. Otherwise, you're just going to do a favor to germs.
Oh yeah, and I mean I'm trying not to get too worried about all those germs around, obviously, but I can't refrain from thinking about the restaurants and because we're talking about workplaces, and restaurants are workplaces for many people. So talking about hand hygiene in such a context, I think is relevant.
You know, it's really interesting in restaurants that people with the germiest hands are the cooks and the dishwashers, largely because they're dealing with the germiest objects in the place. Really, foods before they're cooked are fairly germy. So I think it's really important hand hygiene for that group in restaurants to be emphasized. And we've seen outbreaks and studied outbreaks of noroviruses where obviously it was the serving spoons we found the virus on, actually, because it was contaminated, we believe, by the staff in that. So you can't believe how readily those facilities are and the importance of good hand hygiene in those areas. I mean, not only for the workers, for the people using the, you know, eating food there and that, it becomes really important.
And apart from the hand washing and hand drying steps, do you see any more importance in other hygiene products or hygiene steps? Like I think you've said a bit about hand sanitizing. Would you recommend using hand sanitizers in workplaces?
Yeah, I think hand sanitizers are good. What we've done is put them in places like the coffee break room, and then we released our tracer virus, and we found it reduced the amount of the spread of the virus by 80%, just providing a hand sanitizer in the coffee break room. It was even better when we provided individuals with the hand sanitizers or disinfecting wipes they could use on their desks or in the break room. We found disinfecting wipes and hand sanitizers, we release viruses in homes and schools and that it works quite well in reducing the spread of viruses when we do tracer viruses. We feel that by putting a hand sanitizer, providing disinfecting wipes in facilities, you can reduce the incidence of flus and diarrhea by 80% or more. So it's really important. We've shown that in doing studies in these facilities of the impact. Even in the home, what we found is if you walked into the home and you used the hand sanitizer right away, you reduce the spread of the viruses in the home. And that's one of the key things we've learned, lessons, is when you're out in public and that when you go home, wash your hands right away or use a hand sanitizer. Same thing where you work. When you go to work, wash your hands when you get in. Use a hand sanitizer when you sit down at your desk because you're bringing all those germs on your hands right into that facility. Give you an example. It's been found that when you take a bus to work, you're 6 times more likely to get a respiratory infection and then bring it into that office building. So it becomes really important. Alcohol gels, I hope the future we've seen is products being developed would leave a residual on your hands. So if you use a hand sanitizer, it still may be effective to some degree for many hours later. So we're very hopeful that other innovations are coming along where we have products that leave a residual on the surface that may last anywhere from 24 hours to many months. Antiviral surfaces are being developed by a lot of manufacturers, and we have a lot of hope that there'll be an adjunct to hand sanitizers and hand washing, but you have to put them all together. You know, we've been really dependent a lot just on trying to educate the people on good hand hygiene, but we have to give them additional barriers in case they forget or they neglect it, or education like we're doing now, how important hand hygiene. But we've done it in our studies in releasing viruses, spread of viruses, and that hand hygiene is so critical in reducing your risk, not only the people around you, but in you. You know, and let me give you an idea too of how germy places can be. During the cold season one year, we studied offices at 5 different major cities in the United States. And during the height of the cold season, 1/3 of the surfaces in an office building had the viruses on it. I mean, we were kind of shocked that that much contamination occurs, but what people do is go to work, when they're ill and the colds, I can go to work, cold, sneeze, cough. I'll just contaminate everybody I work with. Maybe get the boss sick, Right? But we were quite amazed. We followed people around, and sure enough, they were leaving a trail of viruses around the facility, in that without really recognizing. Because what you do learn is office workers generally will come to work maybe 2 to 3 weeks a year with a cold, flu, and that, because they don't want to miss work. But in effect, they're contaminating their environment if they don't practice good hygiene habits and exposing their coworkers. Because most people are only miss about 2 to 4 days of work a week, but they go to sick about 2 to 4 weeks a year. And so that it becomes, because you lose productivity. For example, it's been estimated the average cold costs an employee $280, right? For each cold he gets. And it can be, allergies can cost them up to $500. It's interesting, if somebody drops dead at work, it only costs $50 because they're off the payroll. So actually, in reality, going to work sick costs the company more because it lost productivity. And in fact, some people believe it costs companies more lost productivity because of colds, flus, and other minor illnesses than actually absenteeism, where you miss it. So there's a trade-off. That's why I think it's really so important, like educating people and providing the right products and emphasizing the right products in the workplace, because it's really going to save a company money, a school, less absenteeism of children. A lot of school districts, the more the kids are there, the more they get. They get, like in our state, like $40 per student every day. So actually it's very cost effective. We've done studies on providing increased hygiene products and that, emphasizing education. And you can reduce absenteeism, at least in the one study we did, by up to 50%. We were quite amazed by just disinfecting the kids' desks every day. So these interventions really work, and that's why we feel it's so important to emphasize and try to keep educating people. These things really work. Now, one of the things people always are going to say too, well, aren't you making people over paranoid? But I look at it as gambling with germs all the time. You're really gambling with these germs. The idea is to keep the odds in your favor. You want to be in a casino and you want to be the guy dealing the cards, because you know you're going to more likely win than the guy playing the game and that. So really you're playing a game with germs, and the idea is to try to always keep the odds in your favor, and you're more likely to win that way in the end. So don't become over paranoid. Actually, you know what it is we haven't really found out you have to do much more, is just follow the rules we give you, like washing your hands, using disinfecting the key areas. You don't have to sterilize the world. You just have to target your activities.
And from the pandemics that we're all living, we've seen disinfection go up. A lot of companies are adding disinfection crews that will go around and disinfect all the communal surfaces and areas. Do you think at one point, maybe once the vaccines are coming out, or we see number of cases go down, do you think at one point all these good practices might slow down a little bit?
You know, that's a good question, Gary, but I don't think they will, because now we've seen the effects of the pandemic, and I think people will want to avoid those effects: school shutdowns, work furloughs, and that loss of jobs. So I think people are going to pay a lot more attention to it. Even with the development of the vaccine, it's not necessarily guaranteed. One, this virus could evolve, or if there's concern it can evolve, like influenza, where you need a new vaccine potentially every year, a couple of years. Also, there'll be another microbe out there that'll eventually evolve in it. But I think people have become very educated about the potential of the pandemic, what they can do to reduce their risk and the spread of the virus like this. So I think it'll change. Also, it's stimulated a lot of innovation, not only in new products, but the ease of use of products, make them more consumer friendly and user. That's what I think it's going to really help too. What I've seen is an incredible amount of innovation going on in trying to reduce the risk, and we got to make sure, like we're doing today, is put in education with that. The other things that we've been relied on still work, and we still need them, what we're seeing developed is new barriers and new to the spread of disease. And so we got to make sure we have multi-barrier concept here. Every barrier the greater the reduction in odds that you're going to get it. You're going to be the winner with the gamble in germs.
One thing that I might be afraid a bit is the cost of these more frequent disinfection crews going around. And let's be honest, we know that cost is driving a lot of the efforts companies will put. So I know you've said that it's costly to get people sick at or from work. So do you think that we'll see still, we can still see like disinfection practices maybe go down a little bit, but we should, as you said, keep educating people and at least keep the safe, best, first-hand best practices like hand washing and hand drying.
You know, you're really right. Really, the effort in disinfecting and cleaning going on right now is not going to be sustainable. It's just too costly. And I think that's a lot of concern. A lot of the industries, like the hospitality industry, for example, or schools and that, the cost of doing it, I think it won't be sustainable. So that's why we have to rely, again, on a good hand hygiene practices. In terms of cost effectiveness, hand hygiene is the most cost-effective way, because you're dealing with the device, your hands, which is going to play a major role in the transmission of a lot of these diseases. Even though, you know, I want to emphasize too, even though a lot's been said about aerosols and that, these diseases that are like SARS and influenza are primarily transmitted by aerosols, but they're also transmitted by your hands. So you have to cover that barrier too. We're never quite sure how much is by your hands with some of these. But we know from experience with these kind of viruses that occur. So it's always, to me, hand washing is the most cost-effective way for all kinds of diseases. And in some of the data coming out of China in particular, shown that the increased emphasis on hygiene has also reduced the amount of other respiratory diseases, enteric diseases like diarrhea has gone down. So that's why it's so important to emphasize, let's keep this habit, because it's affecting all the kinds of infectious diseases that we get. But you're right. I think sustainability is really going to be a key issue. We've got to have to rely back on largely good hygiene practices involving hand hygiene and other types of product interventions that have always been with us.
And given your very large expertise and experience, what are your insights on what the future of hand hygiene can be? Or you've mentioned a bit about product innovations like barriers and antibacterial surfaces. What the future would look like, do you think, in a post-COVID world? If there is such a thing as post-COVID world, as you said, there might not be such thing. We have to maybe get used.
I can give you what we've done at my university. We tried to make the toilets as touchless as possible. In the restroom, basically automatic sink taps, automatic paper towel dispensers, is what we're going to see. And hand sanitizers are being placed at the door exits and other facilities. So what we're really going to see, I think, is more touchless objects in the restroom. Hand sanitizers will come in more. I think we're going to see that a lot more, because those are really the easiest interventions to sustain, I think. So that the restroom of the future, the only thing you'll be able to touch is yourself, I guess, because there won't be much else to doing that. But that's really important. I mean, in looking at contamination in restrooms, they do get contaminated. The floor, for example, is one of the most contaminated areas, but taps get contaminated. Actually, the least contaminated area in most adult facilities is the doorknob on the way out of a restroom, because usually more than 70%, about 70% of the people wash their hands, at least in Tucson, Arizona. And so I think we need to emphasize more touchless facilities, I think, in there, and that'll really reduce, I think, the spread of a lot of the organisms in public restrooms.
And from these the words that you're using, touchless. I mean, again, since we are not there yet, and we know all public bathrooms are not equipped with touchless devices, do you think that paper towels are a good first step in making a barrier between your hands and the environment in those washrooms?
Yeah, that's one option, particularly if they're not touchless. I've seen people, turn the tap off when you're using, if you have to turn the tap on. Some people just leave it on. I've been quite amazed. But you wash your hands, right? Then you recontaminate them when you turn the tap water off. So one thing you can do is take when you dry the towel, use a towel to turn it off. That's one option that you really have there. If you're really concerned, you can use it to actually open the doorknob, or there are people who have trash cans right near the doors, because some people won't touch the doorknobs, and so they have a waste disposal there. So that's one other barrier that you could potentially use too.
And reading through your different studies, I've learned that you've worked quite a bit on monitoring wastewater, and monitoring also sewage. And what kind of information were you getting from those studies or from those monitoring?
Yeah, we've actually done a lot of what you call wastewater-based epidemiology now, where we can monitor the wastewater to look at the number of cases in a facility. We've been using it primarily in the dormitories on our university. We collect the sewage every day from the dorms and rotate which dorms we use. And we can actually find students that way. We can find a dorm. I'll give you an example. We had 300, and we found 2 students who were infected with the SARS virus by testing the SARS virus in the sewage. So that gives us an opportunity to know how many people are infected in the dorms. We can do that now. And then come in and do antigen tests of the individual students, find out those who are infected, and remove them out of the dorm and put them in an isolation dorm. And we were very successful in reducing the spread on campus by monitoring the dormitories that way. It turned out to be a very effective way of monitoring students, identifying them, and getting them out of the facility. We just submitted a paper on that because we found it to be very successful in limiting the spread at our university all the time. For doing it, but I see that as a future thing that can be used in the. My dream in the future is we can monitor facilities and look at interventions like maybe new hand washing, disinfecting tools. Monitor the wastewater. We can see potentially a decrease in the amount of ill people or infected people. We've seen it work quite well monitoring the wastewater in Tucson, Arizona. What we saw was when the stay-at-home orders came in, the amount of SARS-CoV-2 virus in wastewater disappeared almost. And then when that was lifted, they shot up again to very high levels. And then when the face masks come in, they went down again. So we can see now they're going back up, unfortunately, in the colder weather that we're having, I suppose. But it's quite interesting. It showed us that we could really monitor interventions and see how well they work. The other advantage of monitoring the wastewater is we can see in the future about 4 to 7 days of who is likely to, that more ill people are going to come around. What we've seen is when we find the virus in the sewage of a dorm, within 4 to 7 days, these students will probably go and get a clinical test because they think they might be infected. So it gives us a little bit of a warning too. So it's been kind of exciting that way. We're putting all the math together, and hopefully this will be a tool and useful. But I'd actually like to see it used as a manufacturer has a new product, like say a new hand sanitizer, a new disinfectant, a better way of providing paper towels so more people will dry their hands, maybe even. And we can look at the incidence of different diseases like influenza, for example, or diarrheal viruses, and we can have a very inexpensive way of monitoring facilities or schools, for example. We've been asked that other people are monitoring schools this way to determine whether the incidence of SARS-CoV-2 is going up or down. So I think we maybe created a good tool. There are over 100 utilities in the United States monitoring the wastewater now. So we're getting a really good picture. We can look for other diseases too. I think we'll have a way using the data that might be available from utilities or other sources in the future to really look at how successful we are in different interventions. I think it's going to be important because there's going to be other diseases come along besides SARS-CoV-2. It's, you know, like you've seen now, it'll be probably almost a year before the general public starts seeing readily available of vaccines, even though it may start sooner. It's not going to get to everybody right away. So this becomes really important, I think, for the future.
Yeah, and I really, as a scientific, I enjoy seeing new monitoring or measuring methods like that, and that allows to evaluate the impact of new tools that we have against the warfare or the war that we are fighting against those viruses. And we are well, we're having questions from participants in the chat. So there was one question that I'd like to ask you is, what are your thoughts on disposable food service towels?
I think that's a good idea because we studied restaurants a lot, and a lot of times they'll use a drying cloth or they'll use a dishcloth, a wet dishcloth, or a sponge. And unfortunately, they're supposed to put those in disinfectants, but it's not long enough. Disinfectant gets tied up in the sponge, the dish rag. And I think they should dry tables with a paper towel and dispose of it, to be really honest on it. Also, wipe down the plastic menus. Boy, they get really contaminated too. I only touch them around the edges now because I found too many E. coli on them, because they'll use a sponge or dish rag to wipe them down. I think also it's really important if you have seats for children, you know, that you could use, you know, have these seats special for children. They get really contaminated. We were quite surprised, even though they're supposed to disinfect and cleaning. I think they should wipe them down with a towel because I think they're just spreading microbes around on it. I'm more of a favor of that. Now, some people say, well, that's not environmentally friendly. I say, well, if you get diarrhea, you're going to use a lot more toilet paper or facial tissues if you get a respiratory infection. So it's a cost benefit to me. Believe me.
Thanks. And one other question we had from participant is, what are the long-term effects of using hand sanitizer and breaking down your immunity towards infection or viruses?
Well, I don't think you have to worry about breaking down your immunity from it. There's always plenty of germs out there, for one thing. And really, a lot of people say, well, you need to get, you know, exposed to germs and actually develop immunity. However, we can never predict the outcome. You can always die from common germs, and that is one thing we like to remind. And the other problem people forget is about autoimmune diseases, and that, like, a strep throat was the classic where people develop heart diseases from continual strep infections. But we know from studies that autoimmune becomes an issue. Sequelae or adverse effects from common infections like diarrhea and colds can occur years later. You can get reactive arthritis from like salmonella and these other infections. So every time you expose your infection, you have a risk there. You don't really build up an immune system by getting ill a lot. Either that or, you know, some developing countries in the world where they have high mortality would be the healthiest countries in the world. So if you follow that theory, you should send your kids to a developing country sometime where the mortality can be as high as 50% of the children. So that doesn't really, no real evidence that we develop resistance. You don't really develop resistance to hand sanitizer, for example, because all the alcohol evaporates from your hand. So there's no residual. To give you an example. Yeah.
Okay, and we have another question from our participants. Do you think having RFID units in restroom will help reduce cross-contamination and increase personal hygiene and accountability?
You mean automatic paper towel dispensers? What do you say?
RFID or units.
Those.
I don't know exactly what the participant mean there, but RFID is a protocol to exchange information from devices to
Oh, that
users.
information that's stored. I think that might be useful. I like, for example, with automatic paper towel dispensers, what's the amount of paper you should be using? Maybe you can monitor that too. But that would give you an idea, if you can monitor paper towel dispensing, the amount being used could be useful. What I see is how many people are actually drying their hands and how many are drying properly with hands. You can monitor, take the number of people with devices, how many go into a restroom every day. You can figure out how many are using paper towels and what's the frequency of use for that. So I think that could be really a good thing to do, because I'd like to have more information on that. Most of our work has been observational. It'd really be nice to have hard numbers on stuff like that to provide more insight on usage. Are we successful in our educational programs? Are we getting them to wash their hands more? You can tell from that kind of information. What's the amount of paper, how much paper towel is the average person? I know men use more than women. Of course, then again, women use more toilet paper than men. So, it kind of evens out.
Mm-hmm. One last question was, does ultraviolet light kill virus?
Oh, ultraviolet light's very effective in killing viruses. It's been promoted a lot recently for doing in indoor environments. It's been used in the medical community a lot to disinfect patients' rooms and that, but that's not a substitute for regular cleaning and disinfecting. You have to really clean and disinfect an area first before you use UV light, because the saliva, mucus, whatnot will interfere with the UV light. It can be used effectively, but you have to clean a place sufficiently, and it should be used by people that really know what they're doing, because there are a lot of things you got to be concerned with, distances to a surface and that. So I think that it can further enhance the reduction of organisms, but I think it has to be used by professionals and done by people who are trained in its use in that.
And cannot be used alone, I guess.
Right, it couldn't really be used alone. You don't want to use it alone.
Yeah. Okay. Dr. Gerba, is there anything else you'd like the public to know?
Well, I think this is an opportunity for people in the sanitation and hygiene industry to really move forward in both innovation and education of the general public, because they're listening to you now. In industries, commercial industries like office buildings, airlines and that, launch solutions. So really what they're throwing to you is give us solutions and show that they work. Because we have to have solutions, and we have to have cost-effective solutions for the long term, because some of what we're doing now is not sustainable. We have to look at what's sustainable for the future in that. And that's what we really need to be talking about. And how do we communicate this? How do we demonstrate its effectiveness? In a physician hand, when you save somebody's life, the person is grateful. When a person never gets ill, he doesn't know who to be. He can't be grateful. You're not going to get a medal in this area, but you're going to probably reduce and save more people from becoming ill and more people in dying than any one physician will do in his entire career. And so that should be your pat on the back, is that I can do more for more people by what I can do than one person in the medical profession. I mean, everybody should deserve a pat on their back for being in this industry, if you ask me right now.
Well, thanks for telling us what kind of impact we all can have on public hygiene. So thank you very much, Dr. Gerba. We know you're a busy man, and we appreciate the time you've taken to educate us all on the importance of hygiene. And thanks for all the good work you're doing to educate people. So maybe to quickly wrap up today's session, I think we have 3 takeaways to keep in mind. As you have explained us so well, we should take special care with communal areas in working environments like break rooms. You suggested the use of liquid soaps and sanitizers whenever possible. And second, since the cleaning practices that we've put in place during the COVID-19 pandemic might not be sustainable in the long term, we need to continue doing what we just did, is to educate people about improving hygiene practices. And that includes increasing the hand washing frequency per day, and that should also include hand drying. Third, I think facilities should offer paper towels for hand drying. As we've mentioned, they help remove the residual moisture from hands. They do it very quickly. The friction that they provide with hands also help removing the remaining bacteria, and also they can be used as a tool to prevent cross-contamination. And you've referred to using paper towels also to clean and disinfect surfaces that our hands touch frequently, instead of using common reusable cloth materials. So thank you very much, Dr. Gerba. At this point, I'd like to introduce one of my colleagues, Tad Allen, who's from our sales team. He has a few words to tell you about a new innovation here at Cascades. So, Tad Allen.
Thank you, Dr. Gerba. That was really great information. It's going to be hard to follow up. I'm just going to take a few minutes. There's probably no better time than right now to talk about Cascades and Cascades tandem dispensers. Tandem dispensers, as you'll see here in the background, is our new dispensing system. Gives everyone the ability to have towels, high-capacity bath tissue, and JRT systems. The benefit that brings to the table, the number one thing, is the no-touch experience. As Dr. Gerber discussed earlier, best thing we can do for the restrooms is make sure that you are the only person touching the experience that you have at hand. So with Tandem, the competitive advantages is a no-touch experience, fast maintenance, and high-end, unique looks for office facilities. So as we move on with Tandem, there's some cool key attributes of Tandem that Cascades has developed as well. Our number one feature is hygiene. Is our hygiene feature. Our main thing is to maintain safety in the restrooms and minimize the number of times they need to be replenished. So our key features, once again, is built for better hygiene, seamless texture, finish, reduced cost, and contamination as we move forward. So is there any questions that we have with this? If you would like to have more information on Tandem, reach out to cascadespro.com. And we look forward to hearing from you moving forward with Cascades. Thank you.
Thank you, Tad. Thanks everyone for joining us today. And if you missed any of the session, we'll be sharing a recap on our website shortly. So again, thank you for joining, and most of all, stay safe.